Hello everyone. This video will be a little bit long, so I will upload it part by part. This is a kind of like a registered name, male genital aesthetic. These videos will include some conditions such as penile enlargement, stretching and thickening, curvature of penis, hypospadias, congenital anomalies, shunt rotation. I'm really experienced on these operations because I've been doing them since 2004. I do them a lot. We did a lot of patients follow-ups, did biopsies, and evaluated the results. Talking about my 14 years of experience in these videos. If you ask me why I do this, I'd say because these operations are not well known by public and there are a lot of misinformative stuff online. Sadly, some fellow doctors who have no experience on these operations can think in their own way and misinform people terribly. I am making these videos in order to correct those, to inform new attending doctors and lead a path in good and decent surgical practices. All my professional finesse and experience in this video. One of the reasons of it is that it takes a long time to explain everything to my patients. It nearly takes 2 hours, sometimes even 3 or 3.5 hours. So when the patient comes in, I explain everything, show them photos and charts, then I talk about all the possibilities. But when the patient goes out and another patient comes in, I will have to explain everything from scratch. It's really crazy. If 3 patients comes in a day, that means I am completely exhausted. I have a request from my patients. If they watch these videos before they coming to me, they'll see that everything that needs to be explained by me will be on these videos. So when they come, our job will be so practical and easier. Then we won't be wasting a lot of time. Everyone can watch these videos since they will be on the internet. If they have some questions, they can call and ask or go to the clinic, of course. If they don't understand some parts, they can watch again, or as I said, they can call me or go to the clinic. So I am preparing these videos to inform patients, new attending doctors, and some doctors that have no knowledge about this but still talk about it. These videos will be in parts and I will upload them accordingly because my last video took 2 hours and 20 minutes. It's really hard to watch a 2 hour and 20 minutes video at a time. So I will upload them in parts, then it will be easier to find and listen to specific subjects in any video. By the way, the subjects are so detailed and intricate that there is a lot to talk about. Sometimes I may forget to mention something to a patient, and later I say, I wish I had told him about that. So in order to talk about everything in these videos, I have prepared a text for myself. I will look at it from time to time because the video before this took 2 hours and 20 minutes, and when I watched it later, I realized that I had forgotten so many things. I can skip some of the stuff, so in order not to do that, I put them down on paper, and I think that talking about them in topics will be so much better. So sometimes I will be looking at it like an anchorman. Now, most frequent and absurd thing I have heard is this. A patient comes into me and say, I've been to other doctors before and they told me that. The doctor examines the patient and say that the patient's penis length is normal and there is no need for penile enlargement, and also says that these operations are for people who have small penis and it is for penile enlargement. This is totally wrong. Doctor says 2 things and both of them are wrong. As a matter of fact, Dr. Haydar Dümen, whom we love dearly, states it on a paper. I have read it on the paper. He is not a surgeon, of course, but apparently he doesn't have a lot of knowledge about the surgical aspects of it. Even he says that both of the statements are false, and the reason is that 99% of the patients who consider penile enlargement does not go to doctor because of having a small penis. They go to the doctors because they want their penis bigger. There is a big difference. If they go to doctor to have a bigger penis, it is really absurd to say that this is unnecessary. It is no different than a woman's breast augmentation operation. Can you imagine a plastic surgeon saying that a woman comes for breast augmentation and doctor says that her breast size is normal and there is no need for augmentation? Is this really possible? No, not of course, because the patient comes to you to a bigger breasts. If it is possible, of course it will be done. If there is no extreme situation, the operation will be performed. That the doctor does not understand and know this patient group. This is wrong. The second thing is that these operations are for people who have small penis. This is also wrong. You will see that when I tell you because penile enlargement operations are directly proportional to penis size, it is directly proportional to its largeness. And the bigger it is, the better the enlargement is. You can also do better on thickening and there will be a major difference. But the smaller it is, the more ineffective the outcome is. If the penis is smaller, the enlargement will be less. But if it is bigger, the enlargement will be better. Why? Because we do not add any tissue to the penis. We do not put any extra stuff. We shift the penile tissue that was inside to outside. But some surgeons that do not know about this operation can say that these are for people who have small penis, because it's called penile enlargement. So it's possibly performed on the people who have small penis. Wrong. This operation shouldn't be performed on those patients. This is how I think. I sometimes encounter with micro penis cases. Penis length is 4 centimeters when erected. How many centimeters there can be inside if it is 4 centimeters? How much can you shift from inside to outside? Will it satisfy the patient? No, of course not, because we'll have such high expectation. He wants to have an operation and have a penis that 10 or 15 centimeters long. It's impossible. So there is a lot of misinformation on the internet and the doctors give an answer just by logic. They say that your penis size is normal, so there is no need for an operation. Don't you understand that the patient does not come to you for having a small penis? He comes to have a bigger penis. So you don't understand the patient, so you answer in such way. This is for people who have small penis. This is completely wrong. This means you don't have any knowledge about the nature of this operation. The smaller the penis is, the ineffective the outcome is. This is a fact. When I talk about the misinformation on the internet, I also want to say something about the absurd things I have encountered. For example, some say that they perform an extension below and they do not cut the suspensory ligament. If an extension is made, the length will be that. I have also heard this. If they perform an extension below, it will be 3 centimeters, and if we do it above 3 more, so it will be 6 centimeters long. This is totally nonsense. First of all, and I can say that clearly, there are no such method as an extension below. There aren't also any method that does not include the suspensory ligament. Please be realistic. So why do they say that? Unfortunately, patients are scared of having their suspensory ligament cut. I have seen some videos of some doctors about it too. If you cut it, the direction will be ruined and penis will be saggy. This is not true. You haven't done it, so you don't know how it's done. Cutting the suspensory ligament won't have any harm on patients. This has nothing to do with the erection or position of the penis. Of course, it helps penis to stand erected, and also if you cut it on a patient who has an extremely erect penis, it comes down to a normal position. But when this suspensory ligament is cut, the penis will never look saggy and down. Erection also will never be affected because it has nothing to do with it. I don't know who comes up with this stuff. If fellow my colleagues say that it causes erectile dysfunction, please look up in anatomy book. The veins, nerves, and penile erects tissue has nothing to do with the suspensory ligament. You can think it's a rope. Yes, it bonds the penis with the bone, but if you cut it, penis shifts outward but does not look saggy because there are a bunch of things that holds it. Also, there are no tissues related to erection. Because of that, it doesn't affect the erection. There are a lot of rumors like that. And I hope to correct those mistakes with these videos. So my purpose is that. There is also another thing that pisses me off. They say that they make a filler injection on the glands and it cures the premature ejaculation. Dude, no. The treatment for premature ejaculation is only in psychiatry. There is no surgical or injection treatment. I have written about it a lot of times. Do not try to make up lame-ass surgeries. If you Google injection treatment for premature ejaculation in English, you won't find anything. There is no such thing in foreign studies. This only happens in our country. I also think that it stems from an article I uploaded to my website. I wish I didn't do it. Years ago in cosmeticjarrahi.com, I uploaded an article about male genital surgeries. It was called Glands Enlargement with Fillers. It belonged to a foreign doctor. I thought it was interesting then. They have put the article on the internet. There was also photos and stuff. I uploaded the article because I thought it was interesting. Years ago, I happened to find it absurd. One of my patients insisted so much. He wanted me to perform this operation. He also signed the papers about taking responsibility. I performed this glands injection operation on that patient, but it doesn't cause insensitivity and the filler does not stay there. 3 weeks later, the filler disappears. Even in that article, they haven't talked about the treatment of premature ejaculation. This is something that has been made up by some smart pants in our country. They want to find a way to earn some money with this. And they say that they treat premature ejaculation. Totally absurd. You cannot find something in any part of the world. This only happens in Turkey. This also is not a treatment for premature ejaculation. Patients also say that they do not find it useful. Some of my patients who had it done before also say that. I hope people learn the proper way for it and patients do not want this operation. By the way, there is no such thing as filler injection for glands. I also want to say this. You cannot find it in the books. This does not make any sense because pineal glands is utterly an erectile tissue. It doesn't have a separate skin. It is filled with the blood vessels that looks like a sponge. If you inject something inside it, you block the blood vessels. This has been done before in Turkey. Someone even made a fat injection to the glands for enlargement. You cannot make a fat injection to the glands for enlargement. It is the same with putting fat into the vein or injecting some glue in it. It only blocks the vein. I know what happened to that patient and I don't want to talk about it here. A clever man knows not to inject anything to the glands or does not want to have it done for themselves. Please do not request this operation. Premature ejaculation is only treatable with psychiatry. Either the man talks about it properly. He knows and tells stuff about this subject. He says that solution is to have regular sex. He says it gets better when getting married. Yes, it gets better after getting married. If it doesn't, you should see a psychiatrist. It is only in the head. If you inject something to glands, it blocks the blood vessels. Can I make myself clear? Because this is a fact. I hope people learn it. And this operation won't be performed anymore. Because I still hear about it. I regret uploading that article so much. Some people misused it. So what will I be talking in the video? As I have said, I will talk about everything in parts. I will talk about the elongation, then I will talk about the thickening because those two are different things, but we usually do them in the same surgery. Penile enlargement means both elongation and thickening. We do them at the same time, but the two are very different things in context. Penile elongation can be explained quickly. It has less details, but penile thickening is a very intricate subject. This is a serious modified subject. We have so many more things to talk about. It's really intricate, so I will talk about them separately. First, I will explain the classic technique, the technique that has been on the books. Then I will talk about my modified technique. Why did I change things in this operation? So I will talk about this. I will talk about the biopsies we have done and patient feedbacks. As I've said, I've been doing this since 2004. It is 2018, so I have been performing this operation for 14 years and I have a lot of experience. Patient follow-up have been as good as possible, but this type of patient do not leave feedback so much. That's why I say as good as possible. I will take about all of them. By the way, when I talk about my modification technique, please don't take it as textbook rule. You can find them on the books. These are my modifications. The things I will be explaining to you are not rules, but you can find the classical technique on the books. So why do I talk about this? On one day at a meeting, I was explaining my modification and other stuff. I sometimes said things like, we want this to be done and we want those to be done. So we performed this technique. Some wise guy came up and said, you should be speaking for yourself. We don't do it like that. Man, are you really that stupid? When I say we do it, I mean it as my team. My nurses, caregivers, and anesthesiologists are all working as a team, so I say we do it. Of course, I am not talking on behalf of others. If you are a smart person, you listen to me and benefit from my experience. There is no need to step forward and say this impossible things. I'm sorry, but this is true. I have been holding it in me for years, so now I've been given an answer to him. First, I want to give an outline of the surgeries. If you pay attention, you can see that this is an intro video. I will upload the elongation video and the thickening video separately. This is just an intro and we are only beginning. I will talk about the penis and testicles anatomy first. Penis tissue comes from beneath the pelvis. It goes up in front of the pelvis, then sticks out of there. There is connective tissue between pelvis and penis that connects the tissue to the bone. This is called the suspensory ligament. On that, there is slight ligament which lies under the skin. It is slight and weak ligament. We cut it because it is not functional. But there is no way to elongate the penis without cutting the suspensory ligament. Because elongation means separating the penis from the bone and stick out the part that is in front of the bone. Basic logic is that. So, anatomically, there is no such thing as elongation under the penis. I know this is a fact because to be able to do that, you have to change human anatomy. There is no other way around. As long as the human anatomy stays the same, you cannot do this in any other way. There is no such things as elongation under the penis. When I explain the anatomy to my patients, I give example of thick power cables. Those cables are layer by layer. Each one has a cover. Penis also has a lot of layer on it. You can only reach the erectile tissue by passing them beyond. Nature protects the penile tissue beautifully. There are a lot of thick layers on it. This is also very important. All the important veins and nerves are the innermost parts and comes with the tissue itself. So damaging the nerves that helps penis to erect is not that easy. You have to cut through the penile tissue. You have to literally cut it for that. You cannot damage it otherwise. I want to say something at this point. How the penile surgery is made, patients are always scared of it. They say that they don't want to lose more when they want to so much less. They do not want to damage penis and erection. This is a really interesting operation. We do the enlargement operation but never touch the penile tissue. It is really interesting. So we do the enlargement operation without touching the penile tissue. So how is it possible? We cut the suspensory ligament through the bone and penis sticks out. Basically, you are freeing the penis from the bone. When you cut the connective tissue, you see that it sticks out suddenly. So we don't touch the penile tissue at this point. We only free the suspensory ligament from the bone and penis is separated. When doing this thickening, we do fat injection under the skin. This also has a special method, but this is also important that we do this outside of the protective layers. Fat injection is made under the penile skin, so again we do not touch the penis. Since we did not touch the penile tissue itself, elongation and thickening never hurts the penis. This is an interesting surgery, but a lot of doctors are afraid of this. This is the reason that most of the plastic surgeons don't do it. I think there is no reason to be afraid of. You can make sure that the rhinoplasty is much riskier. Every day, tons of rhinoplasty operation is performed. It really surprises me because the complication in the rhinoplasty is much more than the penile operation. I can say the worst case scenario to you. The fat that you inject can dissolve more than necessary. Patient comes to us 6 months later and we see that most of the fat has gone. But this is not serious complication. We do an injection again and it is usually more successful at the second time. If you think about the risk, for me penile enlargement surgery is one of the best surgeries of the plastic surgery. There is no high risk. I will talk about the reasons when I explain the elongation and thickening surgeries. Everyone is scared of cutting the suspensory ligament. Cutting the suspensory ligament does not cause any complications. We are only talking about the suspensory ligament. It is fibrous tissue. It is a connective tissue that connects the penis to bone. Inside the suspensory ligament, close to the deepest part, there is a small vein. Why is this important? Since there is nothing inside the suspensory ligament, there is no risk of damaging anything. There is nothing inside of it. Close to the bottom, there is just a small vein. It is not important. If you cut it, tells you that you have reached the limit. I will explain it when I talk about my technique. I don't cut the suspensory ligament 100%. I leave some part of the bottom, like 20%, since it is close to the bottom part. Cutting that way means that we have reached the limit. We cut the suspensory ligament and it starts to bleed at some point. It is expected because there is a small vein, as I've told you. Everyone has that, and cutting it means no harm to anyone. When we see it bleeds, we cauterize it and the bleeding stops. And we stop cutting the suspensory ligament. We can say that it shows the 80%, 20% limit. If I write about, that would be a scientific article. Other than that vein, there is nothing inside of it. It causes you no harm whatsoever. Cutting the suspensory ligament has no complication. It's not possible. On the contrary, everyone is scared of cutting the suspensory ligament, and doctors say that we do not cut it in elongation operations just to appeal the patients. This is a lie, of course. There is no elongation without cutting the suspensory ligament. On the contrary, penile thickening is much riskier because we inject fat. Inexperienced doctors look at that in this way. Fat injection is simple procedure. We just inject some fat. They inject nearly 5 liters fat to buttocks to make them bigger. To make a Brazilian butt lift, so we do it in small amounts. It's really easy. No, it isn't. Fat injection is 10 times harder, more complicated, and if there is a complication, it happens because of the fat injection. This is really crazy. Nobody is aware of this, not even the surgeons. They are either inexperienced, they do not know anything about it, Can I make myself clear? Patients are also afraid because cutting the suspensory ligament sounds so scary. Cutting the ligament has no complications, but fat injection may has also some complication. Fat can dissolve more than necessary. Other than that, if you inject extra fat, it can cause difficulty for the erection, but that is not because it damages the penis. That is because the fat amount is not normal. So we have made some modification. We have modified the thickening. I will be explaining this in the thickening video. I will also be talking about the treatment and how to prevent it. This is the worst case scenario. Okay, let's talk about this too. I will explain it so you don't have to any questions left. That patient, only one patient died during the penile enlargement in surgery. Some of my patient comes to me and says, "Doctor, you said it has no risks, but I have read on the papers that one man died because of it." Okay, one man died during the surgery, so this means nobody died before him. This is an extremely safe procedure, and also the reason for him to die is that while injecting fat to penis, they inject the fat into the vein and he died of the fat embolism. This can happen in any fat injection operation, but if you use cannula, it never happens. We do it with cannula. Cannula is a piece of iron that has a round tip and a hole on the side of it. It is a stick since it has a round tip, and a vein touches that tip, goes both sides, and it injects the fat from the hole on its side. So you won't be injecting inside the vein, but syringes are sharp. In that case, doctors most probably did it with a syringe, so they injected the fat inside the vein. This is really wrong. When doing the fat injection, it can never be done with a syringe. Because you can puncture the vein and inject inside of it. If you do it with cannula, it never happens. And also, there is only one case with death. There are hundreds of thousands of people having this surgery done in the world. Just think about it. Just because some ignorant doctor has done it with a syringe, you cannot discredit these surgeries. Until that case, there is no casualty on the surgeries. So you don't have to worry about that case. If it is performed proper technically by an experienced surgeon, there is no risk of that in these surgeries. It is not complicated surgery. It's not performed on deeper tissues or on the penis itself. It's made under the skin and there is no risk when I cannula used. There is also no risk when the suspensory ligament is cut. It is extremely safe. When there is dissolution at the fat, we may have to inject one more time, but I don't say it is necessary for everyone. I have seen some patients come to me 5 or 6 years later and they didn't need any more fat injection. Do I make myself clear? So these are very successful results. Of course, we made fat injection again to some patients. A patient comes 6 months later and we do it again. But this is not a serious complication. Injection only takes 15 or 20 minutes. It can be done with a short anesthesia. Also, it is usually more successful at the second time. I will be explaining this in details in thickening video. Let me check the text really quick. I don't want to miss anything. Okay. Let's talk about a guy. People came to my operation from time to time to learn about it. Especially young people. They come and watch and sometimes help me instead of the nurse, so we do it together. The other day, a doctor came to watch the elongation process and cutting the suspensory ligament in the surgery. We usually perform the surgery in 3 steps. First, we make an injection to the base of the penis to be able to stop the bleeding, but it takes 10 minutes for the medicine to work. First, we make the injection to the base of the penis, then we get some fat from the belly. This is the first step of the surgery. Then we put that fat aside. After that, we do the elongation and we do thickening with the fat we pulled from the body. So the elongation, no, pulling fat is the first step. Elongation is the second, then comes the thickening as the third step. This is how it goes. This guy came and saw the elongation process. Then he told me that he has things to do and left after thanking me. He should have watched the thickening process because the main things I will be explaining is about thickening and fat injection. There are so many things to explain, but he left anyway. Even plastic surgeons do not understand it very well. They think elongation and cutting the suspensory ligament is the main surgery because it sounds so surgical. Cutting the suspensory ligament sounds harder than fat injection. That's not true. What are we doing in penile enlargement surgery? We do elongation and thickening, or we only do thickening. We don't do elongation solely. Why? There are two reasons for that. First, if we just do the elongation, it only grows longer for about 2 centimeters. In some patients, maybe 3. But it never appeases the patient. Also, a dent happens at the base of the penis because of the elongation. I think this is an objective criteria for the elongation. It shows the elongation. The dent at the base has to be filled with fat or it doesn't look nice. For that reason, I think the elongation shouldn't be done by itself. It doesn't please the patient. It causes the deformity at the penis. Apart from the visual aspect, it also won't be sexually satisfying. If you ask me whether elongation or thickening is important, I would say thickening is more important intercourse-wise. Visually and psychologically, elongated penis of course looks nice for a woman, but intercourse-wise, 10 or 11 centimeter is enough. But thickness might not be enough. A thicker penis is more important when the sexual intercourse is concerned. So I recommend either thickening or thickening and elongation. This is also my method. I'm looking at the text. There are a lot of subjects to talk about. Let's see. I have 16-page long text and we are at the second page. Okay, who wants this operation? Sometimes patients ask me about it. They say that is it something wrong with me? How many more people are out of there like me? Who wants it? If you asked me before, I'd say 90-95% of the patients were over 40 and had 2 kids. It was like that before. One day a patient of mine called me and asked a lot of questions. He asked, who wants this operation? I told him that men over 40 and had 2 kids want to have it done. And you are probably over 40 and have 2 kids. He laughed and said, how did you know? Because the percentage is 90 or 95. It is really interesting. It was like that before. But the patient profile has changed over the course of many years. I mean, until 2009 or 2010, it was men over 40 and with 2 kids. After 2010 and 11, young patients have started to come. 30 or even 25 years old men have started to come. In the recent year, it has started to get more interesting. Patients who come with their wives and girlfriends have increased. Before 2017, I have never seen that. But in the last year, people got used to these operations. Patients who come with their wives and girlfriends have increased dramatically. They also come to us too. I can say the majority is men over 40-year-old and with kids, because it became seriously popular. I think people talk about these operations in public and they seem more normal. I also think that there is no difference between penile enlargement and breast augmentation. They both are for sexual life. Women have their vaginas tightened. Why? It is also for sexual life. A woman had given birth 3 kids vaginally. Of course, the vagina gets loose and it affects her relationship. So men want penile enlargement because they want to satisfy their wives or girlfriends. It is perfectly normal. When I started this in 2004, patients were really shy and asked me if there is something like that. Everyone was over 40, but the patient profile has changed now. There is a change and progress in the community. This subject has become more acceptable. If you ask me where my patients come from, I'd say I didn't do a lot of advertising. I still do not have a website about it. I just have one page on cosmeticjarrahi.com and it is only mentioned in 1 or 2 paragraphs. Other than that, I have 2 articles on Milliyet website, but my patients usually come with recommendation. They hear about their friends or relatives. I had some patients come with a relative recommendation. I find it interesting, and I was surprised by it at first, but now I find it normal. A patient had this operation and then brought his nephew. Another one had the operation, then brought his friend, or even his uncle. I think that this operation can now be talked among relatives because there are a lot of patients like that. There are also so much friend recommendations. Apart from that, I can also talk about the penis size. We perform penile enlargement. What is the criterion? How much is the normal size? How many centimeter is it? Etc., etc. Okay. Textbooks say this. How to measure the penis size. Hold the penis and pull it. Leave it. Then put the ruler next to it and take the photo. I find this stupid. From 2004 to 2006, I also did that with the ruler. But this is a soft tissue. There is no bone in it. It is not fixed and also it gets an erection. If you touch it and take a photo without anesthesia, it will be 3 or 4 centimeters longer without doing anything. So this measuring method is a bit hard. Taking a measurement is hard. And patients hardly take measurement before the controls. In foreign countries, there are almost nobody that takes measurement before the controls. They say that there aren't any serious article on this subject. One of the most frequent things the patient asks me is this: how much it will be during erection? Will it become apparent during erection? In the classic textbook, it says that there isn't any accurate study. Patient will take measurement during the erection and will take a photo. Then will come 6 months after the surgery again to take measurement during erection and to take a photo. This never happened. It is also a problem in our country. You ask a patient to take a photo during erection and send it to you, but nobody does that. As a matter of fact, a couple of my patients told me that it is their responsibility, that they will take a photo with measurement and send it to me. People who told me these things have never done what they have said. Nobody, 1 or 2 patients took a photo with their phone before coming to the operation. One of them took a photo with the ruler during erection. I told him to send them to me, but he didn't. He had the operation, then I asked about the photos. He didn't send it to me. He told me that he had forgotten but didn't send it again. He came for his controls at the 9th month. I reminded him and wanted another post-op photo with the ruler while having an erection. He didn't send anything. Not only him, I have seen a couple of cases like that. They show me the photo on the phone. It is on erection. and stuff, but they never send it to me. These kind of patients are having a hard time sending a photo. They don't do it. Now I don't insist on anything. There is only one thing left that can be done. I will say that I will refund 1,000 liras of the surgery fee if they send me pre-op photos and 9 months later post-op photos on erection with the ruler. I will give their 1,000 lira back to them. I don't know if this would be a good solution, but if you leave them be, they never send photos. I will talk about the elongation during erection in the elongation operation video. It is kind of detailed subject. Now, let's talk about the penis length. You know that this is a general video, like an intro for operations. What is normal penis size? It is said that for Turkey it's usually 10 to 18 centimeters long. In my case, my patients have 13 to 15 centimeter penises. These are majority. There are some statistics about it. Generally, it is said that in the Far Eastern countries, penises are smaller, and Latin Americans and black people have bigger penises. This can be true, and I think it makes sense because nature creates the couples in harmony. Far Eastern women have petite figure generally. A small penis is enough to have an intercourse with them. A Japanese man who has 8 or 10 centimeter long penis have no trouble having an intercourse with a Japanese woman. But a Japanese man and a Latino woman relationship is very hard one. Why? Because if you have been to Miami, you will see what I mean. People walk around with bikinis, tangas, and mini shorts there. Their hips are huge. The idea of Brazilian buttocks operation comes from that. Their hips are so huge that any man who will have an intercourse with that kind of woman should also have big penis. Or else the penis cannot find its way through the vagina. This is the reason that the couples are always in harmony. Far Eastern men and women are in harmony anatomically, and Latin American or black men and women are also in harmony. So this is how it is in those races. I think Turkey has an average percentage worldwide, but we also have an 18 centimeter long patient. They even come to make it bigger. He has an 18 centimeter long penis but comes for enlargement. Since it's already big, the enlargement is more successful. The outcome is perfect. I have already mentioned that. We use what we have. We shift the part that is on the inside to outside. Bigger it is, better the outcome is. We have talked about the penis size. Do we have a statistic about the thickness? I haven't seen an article about the thickness size. This is not a topic that has been tackled in details. It is thought that the thicker it is, the better it is. Some guys come to thickening operation 3 times even though they do not need it. They want it thicker and thicker. But there's a problem with this. If you inject too much fat at once, they have a hard time during erection. Erection becomes more difficult. If penis does not get an erection, it doesn't have any use. So we used to inject too much fat before then. We have put a limitation to that amount. How did we do it? I will be talking about it in the thickening video because it is a long story. But as far as I know, there isn't any statistics for the thickness. We shouldn't be going overboard. I think the shaft shouldn't be thickened to the point that it won't be consistent with the glands. If you inject too much fat, you damage the look and endanger the erection. There is also a reasonable amount for thickening. This is the most frequent reason for complication in penile enlargement surgeries. If you inject excessive amount of fat, erection becomes harder. For example, another plastic surgeon at the hospital I work has injected 90 cc fat to an Arab patient. I can imagine what happened. Why? Because Arab patients are like this. They want it so big. They want ginormous penises. When I show them the photos of my patient, like my best cases, they said that they do not see any difference. So I tell them to go to see an eye doctor or you won't be having this surgery. They want their penis to be gigantic after the operation. You will have sex with a normal woman. Why do you want it as big as your arm? This is really absurd. They want it as thick as possible. Probably when that Arab patient talked to the doctor said okay and injected 90 cc. If you inject 90 cc fat to a penis, it certainly cause difficulty in erection. That penis cannot get an erection, at least 3 or 4 months. It will be a problem for that doctor. Why? Because that fat will dissolve a bit. Until that happens and the patient is relieved, he will definitely call the doctor in every 2 days and tell the doctor that he won't get an erection. I told my doctor friend that you are dead. It will because you trouble for about 3 or 4 months. As I've said, the thickening is an intricate subject, so I will explain them in my thickening video. Now, patient comes for consultation. Of course, we explain these things, and it takes 2 or 2.5 hours. Then we examine them. What do we do in the examination? First thing we look is the fat tissue of the belly, because if they do not have any fat on their belly, we cannot perform this surgery. We need that during elongation, but if we only do the thickening, we also need that. We cannot do it without fat. So there should always be some fat on their belly. Sometimes an athlete who uses fat burner comes as a patient. I examine him and see that there is no fat under the skin. You touch the skin and find no fat under it. There is only muscular tissue. We cannot perform penile elongation or thickening on those kind of patients. I can say that clearly. A while ago, I had a case like this. He insisted on the operation. We have made the elongation and found another way of thickening. We extracted a patch of skin from his groin. We removed the dead layer on top of it and wrapped the live tissue around the penis and under the skin. This is also a method, but you cannot have a desired amount of thickening with this. You cannot have a thicker penis with this, like you have with the 50 cc injection. So what happened? Patient was not happy with the result, and if you ask me, the operation was a failure. The patient left, and after 1.5 or 2 years, he somehow found the way to gain some weight. He came to me saying that he now has some fat on his belly. We checked and saw that too. We have done it with the fat injection, then we had a good result. So fat is necessary for this operation. Where do we extract the fat? From the belly, from sides and from groin. You must have some fat on one of those parts. Other than that, we check that fat around the penis. Sometimes they have fat around the penis. Removing that fat does not cause elongation solely. It doesn't cause elongation, but it helps. We don't leave the fat there. We also remove it. We clean up around the penis totally. Then we check the size of penis. If it is too small, the operation will be unsuccessful. If it is in the normal limits, it will be successful. This operation should not be performed on a really small penis. If you do it, you shouldn't give so much hope to the patient, because the difference will only be millimetric. Apart from that, we should check if there is a congenital anomaly. For example, hypospadias. I have seen a patient who is 40 years old but learns that he has hypospadias just now. His urinary meatus is under the glands. He has urinated like that for all along his life, but he doesn't know that he has hypospadias. It is also interesting because he said that he doesn't have any problem. and didn't want the hypospadias to be fixed. Really interesting. He also had a kid. Sometimes they may not know this. If there is an anomaly like hypospadias, it should also be fixed. Then we check the penis skin. In some patients, it's too tight. It's too tight that it feels like the outer layer of a sausage, so tight and stuck on. I have seen those kind of cases too. We shouldn't talk so promisingly about the thickening with these patients, because when you inject fat under the skin, then when you pull out the cannula, it ejaculates most of that fat. If the skin is too tight, it doesn't let the penis to swell out. When we inject fat, the skin should be a bit loose in order to let the penis swell. So we should be checking the penis skin. Does the patient have penoscrotal web? This is kind of interesting. When patient learns about it, all of them say that they have it. The skin under the penis is loose. If you talk about that, everyone has penoscrotal web. But it's not a penoscrotal web. It can be checked like this. You lie the patient down to the stretcher, hold the penis from the glands and lift it, just like a pole. If there's a flap opens up from there, I mean a skin opens up between the glands and the testicles, this means he has penoscrotal web. What does it do? Since there will be a long skin underneath when the penis is erected, intercourse will be difficult. And because of the intercourse is difficult, we fix the penoscrotal web. Fixing the penoscrotal web doesn't cause an elongation at the penis. Sometimes the doctor misguides the patients. They misguide the patient and they say that they perform an elongation operation. You cannot elongate the penis like that. Fixing the penoscrotal web does not mean that you also elongate the penis. When you fix that penis will not even 1 millimeter longer. You only fix the penoscrotal web with that operation and intercourse would be much easier for the patient. Of course, the penis will look longer because when you remove the extra skin, it shows itself. But there will be no elongation and the penoscrotal web operation is not an elongation method. This is a fact. Don't misguide the patients. I am emphasizing the misguiding part, okay? Buried penis. It is really important if the patient has a buried penis or not. Buried penis is a problem that is difficult to treat. If the penis is buried, it has also different types. You have to see the specialist for that. The patient can be obese and the penis can be buried because of the adipose tissue. Abdominal skin can be loose. Maybe the foreskin is left a little bit more. It can be buried because of the skin. It can be buried inside of the skin. These are all different kind of problems. Buried penis because of the obesity and the one because of the loose skin are all fixed in different methods. Doctors should see the difference and plan the treatment in that way. Process is different in each of them. We should follow an aggressive method or it stays the same. I will be talking about it in the buried penis subject because it is another topic. We should also be mentioning about that in the video. Another thing is the circumcision mistakes. We see two mistakes very often. First is conglutination around the glands and foreskin stitch. There are some strips between the glands and the shaft skin. We clean and fix them, of course. Another mistake is removing this foreskin too much at the circumcision. Sometimes they remove too much skin and leave a skin that is only 1 or 2 centimeters long. And when they stitch it to the glands, it causes the buried penis problem. These cases are kind of lucky because buried penis disrupts the penis progress. Penis cannot grow in adolescence since it is buried inside. This must be seen and penis must be pulled out as soon as possible. It must be pulled out and a patch of skin must be applied to the new scar. We usually take the skin from groin or from the leg. This patient usually come to me like this. Sometimes the doctors remove too much skin, then they realize it and pull the penis out, and they place a new skin graft to the new scar. Patient come to me and 2/3 of their penis has a white skin. It is covered with another skin, and the bottom has a darker skin that is 2 or 3 centimeters long. We do elongation and thickening with these patients, but it takes at least 2 sessions. Because in the first session, the thickening cannot be performed successfully. Since the patch sticks to the base, we generally cannot inject anything underneath. When we inject fat under the skin, it causes some deformity. In the second session, we do the fat injection with the elongation and we fix that problem. If the foreskin is removed too much, these kinds of problems can occur. It is also possible to fix them. Penile enlargement and thickening is also possible, but it is wrong to make a promise of solving it in one session. It usually takes 2 sessions. We check whether there is a curvature at the penis or not. Patients usually tell us if there is a curvature, and we want a photo while the penis is on erection. If they say that they have it and want to have it fixed, I tell them that if we see the natural position on erection, we can fix it more successfully. So send us a photo of your penis while it is on erection. Patients usually take their photo at home and send it to us. It is not like the penile enlargement cases. In order to have a better result, you have to take the photo and we check if there is a lesion, burn, or any other skin lesion. A patient came over, he had a consultation. I explained everything in almost 2 hours. Elongation, thickening, and other stuff. He told me that he wants to have a surgery tomorrow. We planned the surgery. Then I told him that I want to see him because we cannot do it without an examination. And he told me that he is not available that day. But the surgery is tomorrow and I will see that anyway. He again said that he is not available. I thought that there is something wrong. I cannot perform the operation if I do not examine you before the operation. Since you are here and you will have an operation tomorrow, I should see you today. He laid down and showed his penis. He has 2nd-degree burn both on his penis and testicles. It is a serious case. I asked him about it. He said that it is because of an allergy. How can we perform an operation like this? So that was the reason he didn't want to show it to me. It is serious chemical burn. I think he put something on it. I told him to go to a dermatologist immediately and gave him the telephone and address of a friend. I told him to see them and have a treatment because we cannot perform an operation after that. We cannot do it like this because we have to suture that area. So examination is a must before the operation. This happened to me twice, and unfortunately both of them were doctors. Since the patient is a doctor, he told me that he didn't have much time because he was coming from another city and he wanted to have the surgery done right at that day. He told me that he would see me at the hospital. I thought, okay, he is a doctor, he must be busy with his patient. I accepted his offer and told him that we will check you into the hospital in the morning and release you in the evening. You can go back in just one day. I went to the hospital in the morning and started to talk to him. He was a kind of weird and anxious. When I asked him about the medication he has been using or whether he has any illness, he said no. When I was talking about the medication, his relatives said, "Do you mean something like this?" and show me a bag of medicine. I looked at the bag and saw that all of them was antipsychotic. It turns out that the patient has schizophrenia. Diagnosis is 100% correct. We shouldn't be performing the operation on this patient. Why, you ask? Because they cannot make any evaluation after this operation. Even though you do an excellent job, he may be thinking something else. You don't know what he thinks, what he sees, or how he evaluates it. All the cosmetic surgeries must be performed on the people who has no problem with their mental health. Some of the doctors says that, don't you think that they have a right to? I don't mean that. What I mean is that they are not suitable for this kind of operations because patients should be evaluating the results properly if they cannot do this. Even though you enlarge the penis, he will come back and say that his penis is curved. Even if you do it with a ruler, he cannot say that it is still curved. He also has a medical report about schizophrenia. This is more than enough for us. If a problem occurs after that kind of operation, I think the only one to be blamed is the surgeon, because this surgery shouldn't be done, so we don't want our patient to have any mental health problems.